Hi folks, the CEREC Ortho software is fantastic at getting full arch scans, but for some people it can be tricky. There's a pretty steep learning curve, and I'm going to give you some tips and tricks so that you can get a consistent sub 10 minute CEREC Ortho scan every time. I prefer the OptiView rather than the OptraGate because the rubber tends to pull on the OptraGate, pulls on the camera and moves the whole thing out of position. The OptiSpray makes scanning so much quicker. It's not worth doing this without the OptiSpray in my opinion. Unlike with the Crown and Bridge, I give it a pretty healthy dose of spray, not just a sneeze, because it makes the scanning so much quicker. The trick to a successful scan is to put the camera in a reproducible position for that first 3 seconds start. When doing the lingual, I tend to go at 45 degrees to the occlusal plane rather than the full 90 degrees. It's a lot easier and you still get the detail that you need. You can see that with the reproducible start position, it's really easy to start every scan quickly and efficiently, and you're not fumbling around waiting for the scanner to register that start point. In the lower arch, I tend to spray only a quadrant at a time. I also use the wooden spatula instead of a mirror. I don't really know why, but for me it helps give me a nicer retraction without being hard and uncomfortable on the tongue. Notice the position that I hold the camera in as I come round the anterior. I transfer from a horizontal position to a vertical position to scan the lower 3 to 3. When you come round the buckle, you may need to pull the OptiView buckly a little so that you've got room for the camera to move around without, again, pulling and dragging on the OptiView. When you hold the camera for the initial start position, the 3 second hold on the distal tooth, always make sure you've got the camera about 2/3 on the tooth, but a third looking distally beyond the tooth. This will make it more likely that you've got enough distal gingiva that you're not chopping off the back half of the terminal molar when you come to this trimming part. I like to trim so that I've got about 2 to 3 millimeters of gingiva beyond the margin of the tooth. When you're starting the scans to fill in and patch in details, always start from the occlusal of the molars and premolars. There's the most anatomy there, such that the camera can pick up where it is in space really easily, and then roll across to the buccal, lingual, forwards, backwards, wherever you need to go. The upper arch is much easier to scan than the lower arch because there's no tongue getting in the way and there's no saliva pooling at the bottom of the mouth. For this reason, I will spray the entire upper arch in one go. I also stand up when I scan and spray the upper arch. For me, this is just easier. Again, get a reproducible start point for that first 3 second hold. This will make the rest of the scan infinitely easier. Switch over to a 45 degree to scan the palatal aspect, and when I'm scanning, I'm watching where the light is flashing on the teeth to see what the camera is looking at. I also use 2 hands when I'm scanning the upper arch. Because I don't have to worry about retraction, I can use my left hand to help stabilize the camera. Doing the final buccal scan can sometimes be a bit tricky because you've got to scan beyond the midline. you can see that because I've been doing this so often, I know the sequence, so my camera is ready for the next scan automatically, and all I'm doing is listening for the tone to change so that I know when to start moving. Because I started the scan a third beyond the distal part of the last tooth, I've got plenty of gingiva distal to that last tooth, and I'm not chopping it off in this scan. Patching in, again, start from an area with good anatomy so the camera can find where it is in space. So use the occlusal of the premolars or the molars. You can actually move the scanner pretty quickly. It's not like the old CEREC Ortho 1 software where you had to move the camera really slowly because it was capturing so much detail. The new software update's great. You can move the camera nice and quickly and actually scan an upper and lower arch in a reasonable time frame. In my case, this one's taken around about 7 minutes or so. Okay, so now for the buccal scans, make sure you take the OptiView out, otherwise it could be a little bit awkward. And again, I'm not waiting for the computer to tell me what to do. I'm just getting on with it and trusting that the computer is not going to crash on me. I start from an upper premolar, wait for it to register where it is, and then just go down, forwards and backwards until I get the tick. And then the same on the other side. If you've got a tricky occlusion, have a look at the computer and have a look at where it's asking you to start. And there you have it, folks, an upper and lower scan in less than 7 minutes. Thanks for watching, everyone, and if you have any questions, just drop me a line.